Dear learners, in the last class, we learned about the classification of the various poisons based on the nature, manner, and then according to the duration, and importantly, according to the symptoms that they are producing. We also learned classification of the poison according to the use, according to the organ systems that are getting affected by a particular poison, and finally, according to toxidromes. Also, we learned difference between ideal, suicidal, and homicidal poison. Today, we will learn toxicokinetics and toxicodynamics of the poison. Toxicokinetics, as the name suggests, that kinetics of the toxins. It is what the body does to a toxin. From the ingestion to the activities that is done on a poison by the body are included under the toxicokinetics. That is all the steps from the intake, absorption, distribution, metabolism, and finally excretion of the toxin is toxicokinetics. That is ADME. You may remember it. Toxicokinetic describes how the body handles a toxicant as a function of dose and time, whereas toxicodynamics is the what the body does, poison does to the body. Toxicokinetics is what the body does to a poison, and toxicodynamics is what the poison does to a body. That is toxicodynamics. So, with this picture, you may understand that from the exposure of the poison to reaching through the blood till the plasma concentration, and thereafter once it goes to the blood and the tissues, it acts on certain site of action or the certain receptors, and from there it causes toxic effect. So this part of the exposure to the in the plasma concentration is called toxicokinetics, whereas the action site of action and their toxic effect on the body are under the toxicodynamics. So toxicodynamics and toxicokinetics are basically the similar to the pharmacokinetics and pharmacodynamics that are learned in the pharmacology with respect to the drugs, and the same is applied with respect to the poison, because poison is also a form of the xenobiotics, a form of the external agent or drug that is taken from outside. So most of the principles of toxicokinetics and toxicodynamics are same as the principle of pharmacology. I will be revising most of those things that you have learned already in the pharmacology. So coming to the toxicokinetics, that is the ADME, from the ingestion to absorption, distribution, metabolism, and excretion. So absorption is the rate of chemical absorption from the site of application into the bloodstream. Distribution is the rate and extent of chemical movement out of the blood into the tissues. That is, from the blood to the tissues is the distribution. Metabolism is the rate and extent of chemical biotransformation into the metabolites. So, the biotransformation of the chemical substance is the metabolism. Excretion, the rate of the chemical removal from the body, is the excretion. So, you can understand this from this picture very well, that if drug or a poison having the many properties like non-compartment features, zero order kinetics features, different physiological features, and they have different half-life, their clearance, their nature, their volume of distribution, their bioavailability, and according to that, once the poison has been ingested or inhaled or taken in by the different routes, that is, absorption happens from the ingestion, inhalation, the skin penetration, parenteral, or any other route. Once it comes to the body, then it will pass through the different types of the transportation, active transport, passive, or the facilitated transportation to the tissues, and there it will be distributed into the different system of the body depending upon their nature, that they are the fat soluble or water soluble or to pass through the blood. So they will be to go to the highly perfused organs more, and they are whether able to cross the blood-brain barrier or not. If they are able to cross the blood-brain barrier, then they will go to they may be the neurotoxics. So this will be distribution of the drug, and then there will be metabolized as per the phase 1 and phase 2 metabolism kinetics, and then they will be excreted through the various routes, mainly majorly from the kidney. Some poisons are excreted through the lungs, feces, saliva, lactation, and even through the sweatings. They may be excreted out through the body. So this all mechanisms are covered under the toxicokinetics. So a drug can have different routes of administration, like inhaled in the gaseous or vapor form, a volatile substance like gas, dust, smoke, aerosols, volatile solvents such as benzene, toluene, xylene, acetone, methylene, chloride, methyl chloroform, and carbon tetrachlorides. Some industrial exposures like some methyl isocyanide, or in the form of aerosols, maybe inhaled or like that. Similarly, solvent sniffing seen among the adolescents, that has inhalational poison. Accident in some cases, home gases such as carbon monoxide, hydrogen sulfide, and methane in industries. Smokes and dust of industrial origin may involve lead, mercury, silicon, asbestos, and beryllium. So these all forms of the poison can go through the inhalational routes. And another route can be the injection into the blood vessels, parenteral route, and then the intramuscular, subcutaneous, or intradermal injections could be the route. Applications to the wound can be the another route. Application to the serous surface, directly oral mucosa or the esophageal mucosa, or any of the intestinal surface or anal surface. Application to the bronchotracheal mucous membrane, that is under the respiratory tract, that may be the source where the directly it is placed, and that may be absorbed from there. Introduction into the stomach may also be the mechanism where the it is directly introduced in the stomach through the tubes or some catheters. Introduction into the natural orifices like rectum, vagina, urethra, there also the absorption of can happen, and that this drugs or the poisons may be administered through these route as well. Further, the application to the unbroken skin. Sometimes this also may be some drugs and some chemicals are directly absorbed through the skin as well, like the organic phosphates, nicotine, some organic solvents, and leaviside gas can penetrate the skin and produce intoxication and death. Other substances which are absorbed through the skin are phenol and its derivatives, andrine, methyl salicylates, mercury, tetraethyl lead, alkylated compounds, canthridine, hydrocyanic acid, hormones such as estrogen, progesterone, testosterone, and deoxycorticosterone, vitamin D, and vitamin K. These drugs are absorbed through the subcutaneous route through the application to the skin. So, and I would like to share a case that I came across while doing autopsies, that once the motorcyclist carrying two rear passengers was driving on a road, and sometimes back a truck carrying some chemical substance, chemical liquid passed, and due to damage in the tank of that truck, some liquid got spilled over the road. And when the bike was crossing over the road, it got skid, and all the three fell on that chemical. And it was not in a very large quantity, but almost 10 to 15% of the body surface area of each of them got involved, and they felt the burning sensation on the skin, and they took out their clothes, and they asked for the help, and people took them to the hospital. So they were brought to the hospital, and then doctors did not thought much about that, and just simply thought it is a case of a chemical burn and treated accordingly, so as per the burn patient protocol. But unfortunately, all the three of them died within 24 hours. Two of them expired in 4 to 6 to 8 hours, and the last one expired in by the night. So this they all were brought for the autopsy examination, And at the autopsy, with the smell of the chemical that was emanating from the body, we were able to diagnose this to be a case of the phenol poisoning. And we examine and we find whatever the findings, and we sent the viscera for the chemical analysis. That also gave the report of the phenol compound. And the next day newspaper as well came with the our finding that this truck that was carrying was the phenol compound, and that became headlines in the newspaper. And that the compound, that is the interesting thing, or you may say that sometimes such is a unique or a special cases where the subcutaneous or the contact, dermal contact was the fatal to the life of all the three of them. So this knowledge shall be there to the doctors as well, so that they may suspect accordingly, because chemical burn, they may be poisons, they may act through the dermal route, and they have the toxic features of the poisonous substance. So this is the case to understand the skin route of the ingestion through the skin. Now once it gets absorbed in the body, it is distributed in the different compartments of the body. The better the distribution of a poison in the body can be explained nicely by three compartment model. That is, water soluble poisons like alcohol go mainly to the water compartment, and the fat soluble poison go to the fat, like the organochlorines, go to the fat compartment of the body. And those of the poison who are bone loving like metals go to the bone. And there is a continuous movement of poison from one compartment to the another compartment. This is the three compartment model of distribution. And thereafter, once the body, it has been reached to the respective sites or respective tissues, then it is the metabolized. So metabolization of the poison happens through the biotransformation. So biotransformation, it is a biochemical transformation of a chemical. It is a process by which the body transforms a chemical and makes it more water soluble. So the basic purpose of once think like that once someone has ingested the poison, so body will try to overcome the poisonous effect of the poison. So most of the poison, majorly of the poison will be excreted out of the body through urine, through feces, through sweating, through the lungs, or through the expiration. Like that, it will be excreted out of the body. Those poisons which are getting ingested or to the reaching up to the tissues, they will be, now the body will try to segregate it into some inactive form in some unaffecting areas. They will be segregated out in the bones, in the fat, so that it will not have much harmful effect. And the rest of the poison, the body will try to transform into the water soluble form, so that it will be eliminated or excreted out through the urine. So this elimination of the biochemical substance through the biotransformation is basically the metabolism of the chemical, to make it more water soluble, and excretion through the kidney. Liver is the very major site of the biotransformation. One thing important to learn is that sometimes biotransformation can produce metabolites that are pharmacologically active and even more toxic. For example, parathion produces a toxic metabolites called the parathoxone, that is more toxic. So this is also things to be learned. Further, once they got the water soluble, they will be excreted out of the body, or it will be converted into the less toxic forms. So there are two phases of biotransformation. Phase 1 is the drug is converted into the more polar compounds, like the procedure could be the oxidation, reduction, hydrolysis. And phase 2 will be the drug or its metabolite is conjugated with an endogenous substance like glucuronide conjugation. So in this way, many other enzymes are involved in the conjugation processes. So this phase 1 and phase 2 will lead the poison to get converted into the more water soluble or into the less toxic product. Further, you can understand this fate of poison inside the body. The poison got ingested either through the gastrointestinal oral route, so it will go to the liver and then it will be excreted in the bile, and then again it will be excreted through the feces. It may be inhaled and then it goes to the lungs, and from there it goes to the blood, intravenous routes, causes 100% bioavailability. And through the other routes like orally injection or the dermal or the other injection, there is no 100% bioavailability. So that will depend upon what is the bioavailability of that drug through different routes of injection. So once they will reach to the blood, they can go to any of the organs. Through the kidney, they will be excreted out. Through the lungs, they may be expired in the air, or it will act on the body organs. So different body organs, and it will produce the sign and symptoms. Otherwise, it may go to the extracellular fluid or even the fat compartment and get secreted, and may be excreted through the other means. But once the body goes to the tissues or the receptors, they will now perform their action. That it will be dealt under the toxicodynamics. So the greater part of the poison is thrown out of the body as a result of vomiting and purging. The portion that is absorbed mainly is deposited in the less soluble form in the liver, which either partially metabolizes or completely destroys it. The unaltered portion enters into the general circulation and acts on the body as a whole or on the particular system organ with which it has a special affinity. So major portion of the poison gets excreted out. The remaining portion goes to the liver, where it will be undergo the biotransformation into the less efficacious form or the water soluble form, and then again is excreted out. The unaltered portion that will enter into the blood or circulation and then reach to the respective organ, and where they will act according to their affinity to that organ, provided the poison is not destroyed or made harmless by the kidney and the muscle. Some inorganic poisons like arsenic and antimony are retained in certain tissues such as nails, hair and bones for a considerable period of time. So we will learn while diagnosis of the poisons, we may detect these poisons from the nails after a long period of time. Even we may date the poisons when it was ingested or intake had happened from the nails, hairs and the bones, particularly for the metal poisons. Certain poisons like chloroform, phosphorus, nitrates and acetic acid disappears by evaporation or oxidized or destroyed in the body, and no trace of them can be detected in the viscera or tissue if the postmortem is delayed. So these poison even they cause the mechanism, but if the postmortem is delayed, they may be evaporated or oxidized or destroyed inside the body itself after the producing the clinical features, sign and symptoms. Further, some poisons that is to note is excreted in the stomach, so that they are given parenteral route, they will be excreted in the stomach, so that it will be excreted out of the body. But these compounds are useful for us in the form that we may detect it in the viscera chemical analysis. In the stomach content, we may detect those poisons that includes acid, salicylic acid, barbituric acid, probenecid, bases, theophylline, antipyrine, aminopyrine, quinine, levorphenol. Under the narcotic, cocaine and amphetamines can be found in high concentration in the stomach even when given parenterally. So these substance of abuse, narcotics, cocaine and amphetamine, even they were taken apparently, may be found in the stomach. So stomach contents shall be kept for the viscera chemical analysis, and they may give the positive report for those chemicals, those poisons as well. Further, some of the drugs are excreted in the human bile. So bile shall also be kept for the toxicological analysis during the autopsy. So that the drugs, antibiotics like ampicillin, chloramphenicol, tetracycline, gentamicin, erythromycin, doxycycline, cardiac glycosides like digoxin, digotoxin, antineoplastic agent 5-fluorouracil, doxorubicin, vincristine, steroids like hydrocortisone, estradiol, testosterone, other drugs like acetabuterol, carbamazepine, carbenoxolone, diazepam, indomethacin, metronidazole, they are all excreted in the human bile. So in cases where the cardiac poisons has been used like digoxin and digitoxin, the one of the good sample for the collection is the human bile for the diagnosis or the testing purpose. Now coming to the toxicodynamics, that is what the poison does to the body. So once the poison enters the tissues, they act on the receptors according to the pharmacodynamics. You already have learned, and I will not go much detail of those receptors, certain cholinergic receptor, adrenergic receptors, and all those receptors in the body and different organs system. They have directly damages the different organs. So they, depending upon their affinity to the particular organs, they will produce the toxicity. So here the dose response curve is very important to learn, where the dose has been given and the response will depend upon the effective dose for the drugs, that is the where it starts to act or produce the clinical benefits to the patient, and the at this dose it causes the lethal dose at which it causes the fatality to the patient. So within that range it has to be given. So fatal dose and fatal period, you must have to know about the poisons. So fatal dose is the amount of drug that would sufficiently kill 50% of a test population. It is same as the lethal dose. So what is the fatal dose of a particular poison? You must remember for your exams also, or for passing your undergraduate course as well. Another is the fatal period. What is the time period that a person will, time in which a person dies if given a fatal dose? So what is the fatal period after giving the fatal dose? That has to be known for the treatment purpose also, because what amount he has ingested, whether this is a fatal concentration or not, and how long we have time to make the person survive. So it is important clinically as well. For the therapeutic index or the ratio, therapeutic index or the ratio is the comparison of the amount of the drug that causes the therapeutic effects to the amount that causes the toxicity. So a therapeutic index is the lethal dose 50%, 50 divided by effective dose 50. So the drug with a higher therapeutic index are preferable for the treatment. If therapeutic index of a chemical is less than 10, then it is considered a poison. So categorizing a poison or defining a poison can be based on the therapeutic index as well. If a chemical is having therapeutic index of less than 10, then it is a highly toxic chemical, and it will be labeled, it shall be labeled as a poison. Suppose paracetamol, effective dose is 500 milligram and fatal dose is 10 grams. So what will be the therapeutic index? So paracetamol therapeutic index will be 10 grams divided by 500 milligrams. So it is 20. So that means it is higher than the 10. So it is safer to use for the treatment purposes. So like that, we calculate the therapeutic index for a drug. So this is toxicodynamic effect of a drug. Further, this based on the LD50, lethal dose 50, the drugs has been categorized into the super toxic, extremely toxic, very toxic, moderately toxic, slightly toxic, practically non-toxic, depending upon the what is their general dose and how much amount they are the fatal for the person. What is the lethal dose? Suppose a few drop of a drug is fatal, which is being used in the quantity of less than 5 milligram per kg. So this will be under the super toxic category. Similarly, those which are used in the 15 grams per kg and more than, and the toxic dose is the more than 2 pounds, then in that case is practically non-toxic. So in this way, toxicity rating has been done by Gosselin, Smith and Hodge. This is a way to do the toxicity rating, and it may be helpful if you have the poison having the particular toxicity rating. So we may be alert about those poisons. Further, after the body it has acted on a particular receptor and we knew what is the fatal dose, fatal period of a poison, what is the therapeutic index, then they will act on a particular organs to produce the clinical features and the different organ system they will work upon. So different poisons act on the different organ system. Like the compound acting on nervous system, they causes paralysis within second. They may directly damage the neurons and nervous tissues, and they for example, the nerve gases which is synthesized in the warfare or industries are the neurotoxins. Similarly, some poisons may act on the like the inhaled or ingested cyanide may cause instant starvation of the energy by the poisoning mitochondria and synthesis of the ATP. So they paralyzes the person, they damages they causes the asphyxial sign and symptom, so that the body will not be able to utilize the oxygen and the person will dies because of the asphyxia. Further, the another mechanism can be the intravenous injection of an unnaturally high concentration of potassium chloride. So, potassium chloride, how it works is causes the stopping of the heart by eliminating cell potential necessary for the muscle contraction. So, this they cause the cardiac muscle contractibility, they affect the cardiac muscle contractibility, there potassium chloride causes the damage. So, a drug or a poison may act on the major system, nervous system, directly act on the nervous system, may directly act on the drug, may act on the pulmonary system, or they may act on the blood vascular system, they may act on the cardiac system as well. We already learned the classification based on the poisons acting on the different systems of the body. Some poisons may be the nephrotoxic, some poisons may be the adrenotoxic, some poisons may act on the livers as well, hepatotoxic, and like that. Further, the factors that are modifying the action of the poison. So, there are multiple factors that affect the action of the poison in a human being. So, it depends on many factors. Some person may be more tolerant to a poison, some person may be less tolerant, some person showing the effect at a lower dose, some person showing the effect even at not showing effect at higher doses. So, like that, multiple variations are there and multiple reasons for that may be there. The important is the quantity. More the quantity, more severe are the toxic effects. A large quantity of poison taken orally may cause excessive vomiting, causing its rapid elimination and decreased toxicity like alcohol and the corpuscle fate. The action of poison varies with the dose as well. So, for example, very large dose of arsenic may produce death by shock without causing irritant symptoms, while moderate doses produce irritant symptoms and small doses produce therapeutic action. Similarly, different forms of ingestion may have the different effects, like poisons taken in the physical state will also affect the poison. Poison acts most rapidly when the gaseous form are ingested and less when the liquid form is ingested. In case of solids, the action depends upon their solubility. Further, the chemical combination. The action of poison depends upon the solubility or insolubility resulting from a chemical combination. Silver nitrate and hydrochloric acid are both strong poison, but when combined form an insoluble salt of silver chloride which is harmless. A substance may be harmless in metallic state, but its salts may be toxic. Like the arsenic is not poisonous, but its salts are poisonous. Certain poisons which are not soluble in water may become dissolved in acid secretion of the stomach and absorbed into the blood, like lead carbonate, copper arsenide. Sometimes, depending upon the mechanical combinations, the action of a poison may be altered if combined mechanically with inert substances. Like a small dose of the concentrated mineral acid produces corrosive action, but the same dose largely diluted with water is harmless. Further, the rapidity of action is in the order described under the route of administration has also the modifying the poisonous effect. As the rough guide, if the active dose by the mouth is considered as a unit, the rectal dose is about 1.5 of the two and the hypodermic dose is 1/4. A lethal dose is usually 10 or more times the maximum medical dose. The rate of absorption from the alimentary canal is variable. Absorption of a stomach occurs more rapidly when the stomach is empty and when it is full. Absorption may be hastened if nature of stomach content is such as will dissolve the poison. Example, action of phosphorus will be hastened if the vial is taken immediately after it is swallowed. Gastroenterotomy hastens the entry of poison into the small bowel. Sleep, narcosis, and the trauma causing the gastrointestinal stasis will retardation during the gastrointestinal absorption, dilution, and the alteration during digestion or metabolism by the action of liver render some poisons almost inactive and greatly reduce the potency of the other. The skin is on the whole a bad absorptive organ. So, depending upon the route of administration, the effect of the poison will modify. Severity and rapidity of action will depend upon the route of administration or intake of the poison. Poisons are more fatal when taken into the empty stomach. Further, the condition of the body will be affecting the action of the poison, like the age. Age has a considerable effect upon the dosage of a drug. Greater effect at the two extremes of age. A child under the 2 years of age has not yet fully developed the drug metabolism of the liver and doesn't have an effective blood-brain barrier, and as such is much more susceptible to the effect of most drugs. There are some drugs which the children can take more than their proportionate dose, like mercury and the belladonna. There are some of which they cannot take even a proportionate dose, like morphine. Further, the idiosyncrasy. It may be defined as inherent personal hypersensitivity to the agent in question. Certain people are sensitive for the certain drugs and even articles of the diet like shellfish, eggs, and the fruits. The symptoms usually occur in the skin as in urticaria, but may be of the more general nature with the dyspnea, rigor, fever, diarrhea, hemorrhage from the bowel, and the albuminuria. Fatal cases are comparatively rare, but symptoms may be alarming and dangerous. Iodine, bromine, opium, belladonna, cocaine, aspirin, penicillin, and mercury are common examples of drugs to which many people are allergic. Tolerance is the effect of certain poison decrease with the habituation. Tolerance is the ability of an organism to show less response to a specific dose of a chemical than it showed on a previous occasion from the same dose. It results from a decreased reaction between the chemical and the biologic effector substance. Opium preparation frequently taken lose much of their effect after a time and required to be administered in the increased dose. Addicts can tolerate quantities of drug which would endanger life if they had been initial doses. Tolerance is seldom a natural phenomenon. The same effect of habit occurs from the use of tobacco, alcohol, cocaine, morphine, and other alkaloids. It is more usually a feature of natural substances, less of synthetic drugs such as sulfonal, barbiturates, chloride. Tolerance for the mineral substance is limited, but it occurs in connection with arsenic to a certain extent. Further, the state of health also decides the action of the poison. A healthy person tolerates better than a disease. General debility, senility, chronic or disabling disease may cause death of a person to a dose that is ordinarily safe. Carbon monoxide may kill at a blood saturation of only 25 to 30% in the ill health person. In some diseases, larger doses of certain drugs may be given without harmful effect, like opium in tetanus, delirium tremens, and mania, and strychnine in paralysis. While in other diseases, certain drugs cannot be given in a small doses. Opium in glomerulonephritis, bronchial asthma, and mercury in the chronic nephritis. Sleep and intoxication also affects the action of poison. The action of poison is delayed if a person goes to the sleep soon after taking it. The action is also delayed if one takes a poison in an intoxicated condition. Cumulative action also has the effect, that is, the poison which are eliminated slowly may accumulate in the body when given in a repeated dose for a long time and may ultimately produce symptoms of the poisoning. So, with this is all the factors that will be affecting the action of poison in the body. So, with this, this is all about the toxicokinetics and toxicodynamics of a poison. Thank you so much for your patient listening.